Heartbeat pulsing, neon lights are blinding. Lost in the rhythm where the future's unfolding.
What's up? Hey guys, hello and welcome back to my YouTube channel. It is Magwaba, but you can call me the Mad Guy T. Guys, I felt compelled to do this video because as somebody who has done OSCEs before, as somebody who has now been quite involved in students' OSCEs in terms of assisting either as a model or assisting either as somebody who's going to be a timekeeper, I've seen a lot, and I felt compelled to share some tips on how to perfect ourselves and how to prepare better in order to have the best OSCEs. So like I said, I am Tsepo Magwaba, but you can call me the Med Guy T. I'm a junior doctor working in Pretoria in South Africa. I studied at Stellenbosch University and I completed my MBCHP in the year 2022. Yes, so what is an OSCE? So an OSCE is your objective structured clinical examination, and I felt like a lot of us in the health profession have had to do it. Our colleagues at allied health sciences, the nursing students and the medical students, everybody knows the bread and butter of clinical examinations. It's definitely OSCEs, and OSCEs are not easy. As somebody who had major anxiety in university, I think about the things that I've done in OSCEs before, and sometimes I cringe because I'll be like, what was that? What was I doing? You'd even forget the simple things as washing your hands to say, how do you go about doing it? If you guys see me looking down, just know I did write a couple of things down, pointers on topics which I want to cover so that we can have a fully comprehensive and detailed video. If you do enjoy this video, please don't forget to like. So yes, if you enjoy this video, please do like, share, comment, and don't forget to subscribe, because on this channel we're creating lots and lots of great videos. We're focusing mainly on lifestyle and also on medicine, because I feel like medicine is the backbone of this particular channel. So why am I dressed like this? Why am I wearing a tie to this? So in preparing for an OSCE, I think the most important thing that we always have to do, please dress up, dress appropriately, dress nicely. First impressions count, and you never know who's going to examine you, and you never know if the person who's going to examine you, it's maybe some people are still very traditional. They believe that a doctor needs to look a specific way, and most of the people who examine us in OSCEs are consultants, they are professors, they are older. They believe that when they were doing medicine in the 1980s, people looked a certain way, and now look at these young doctors, how they dress, they put in their the profession into disrepute and all of that. So you do not want the person examining you to have all of those and to have that bias against you based on what you are wearing. And with this, please guys, don't stop wearing scrubs to clinical OSCEs. I know most people feel like scrubs are comfortable, but scrubs are not the official uniform for doctors. So please, let's not wear scrubs to OSCEs. Dress nicely, dress well, dress like somebody who would walk into a room and everybody will turn around and look you at. Because you know, the thing about dressing nicely, dress like you're going to an interview. When you are dressed up, you feel confident. People sit up and want to listen to what you're saying because they believe that he's dressed nicely, probably he knows his stuff. So one mark to you, tick for that. So dress well. Don't look like you just rolled out of bed and then you came to the OSCE. Please take a shower, look presentable, and go to your OSCE. That will be very, very helpful. I find that dressing well will turn heads, will look at you, will want to listen to you. So yes, firstly, I'll say dress up. Secondly, be confident. Be confident. I feel like most of us, we are not so confident. If you were to find me on the outside setting, you'd find that I'm very timid as a person, and I don't come across as very confident. I don't walk into a room and demand attention, but on OSCEs, that's what you need. You need to be confident, you need to look up, you need to speak up, you need to look like you know your work. Even when you are shaking, even when you are trembling and you are stressed and you feel like I can't do this, you fake it. When I was in medical school, I used to do the Superman pose. Every time before I left my room to go to an OSCE, I'll do the Superman pose, and I felt like in that moment, I felt like the Superman, and I felt like I could do this. I felt like I could go into this OSCE and I would kill it. And it really, really helped. So please look confident. Even if you are faking it, fake it until you make it. Walk into that room and command that attention. Even when you feel like this station, this OSCE, I'm not really ready for it, look confident. When you look confident, you might even give your professors answers that are very wrong. They might look back and be like, what was that candidate saying? I don't remember that. Maybe it's the latest study, and then they give you the marks. They pass you because you said what you were saying with conviction, and they really believed on what you were saying. So please, fake it until you make it. So we said dress properly. Secondly, be confident. Even when you don't feel confident, fake it until you make it. Thirdly, please prepare from day one. When you enter a clinical rotation, ask your predecessors, ask them, how was the OSCE? How was the structure? Was it multiple stations? Was it one station? Did you have one patient and then you spent 45 minutes on? Or was it multiple stations? If you know the format of the OSCE, you are able to prepare for it from day one. And if you are better prepared for it, trust me, you will be more at ease. Like you cannot even over prepare. You don't want to come 2 days before the OSCE and now you're trying to prepare, you're trying to find the format. You will be very, very confused. You'll be stressed. So prepare from day one. Speak to your colleagues. Ask them, what stations were you asked? They might not repeat the stations, but remember, the principle stays the same. The principles will remain the same. The shoulder exam will stay being the shoulder exam. Whether you can ask it different ways, but it will still remain a shoulder exam. They might say there was a dislocation. They might say now it's a fracture. But remember, the principles stay the same. The test that we drew stays the same. So better prepare. And how also do we prepare? I've seen that most students, I don't know, they come across as very afraid to do things, to try things, especially in the wards. Guys, in the morning, in the morning, it's quite busy. There's a lot of people going up and down. There's rounds happening. I know it's quite overwhelming. There's so many people coming in and out of the wards. But in the afternoon, those are the best times to see the patients. So see the patients, collect the patients, examine the patients. We've seen students coming to PITS exams and then when they were asked to examine the child, you can see when someone has never ever examined a child in their lives. They look terrified, the child will start crying and they don't know what to do. It throws them off, but if you've been examining kids, you will know how to handle those cases when the child is crying, when the child doesn't want you to touch them, to go to say, this is how you would go about doing it. So preparing on time means also seeing the patients, clicking the patients also. So we've spoken about that. We said dress up, we said be confident, we said prepare from day one, examine the patients. Be comfortable with examining patients. You can please, often the mistake that students do, you want to collect patients in groups, you want to collect patients with your friend. In the OSCE, you are alone. try to start doing it by yourself so that you become confident. Because sometimes your colleague is the one who is examining the patients. You are also there, but you're really not examining. So learn to do things independently, because on the OSCE day you are on your own and we are all rooting for you. We want you to pass, we want you to win. Thirdly, and another point, I think it's point number 4, arrive on time. Please, it's very important, be early. Be early, be on time, don't be late. They cannot be waiting for you to arrive. If you arrive early, I know sometimes the other people might start stressing you out. For me, what used to work when I was doing medicine was that whenever I arrived at an OSCE and I got there early, I would sit alone, maybe listen to music, maybe go through a few things. In those moments, I know that I don't want new information to be introduced to me just before I start the OSCEs, because often what happens is people are going to start talking, they're going to start saying a lot of things, and then you become confused. You might be a bit stressed to say, maybe I didn't look at that, maybe I should look into that, and you stress, and then that thing's not asked, and then you're like, what was that stress for? So arrive early, be on time. If you are too early, try to stay away from people so that they don't stress you out. Now, let's get into the OSCE. To say you get into a station, then what? Always, you know the time that you have to do this OSCE. So stick to that. Have that in mind to say, this is the 4 minutes that they have given me, and then I'm going to use my 4 minutes wisely. So now, first things first, they will tell you, there's the scenario, read it and do your thing. Please guys, read the scenario. Be sure that you understand what is it that you are being asked. I've seen that sometimes the students would read the scenario, but because they are so stressed, they don't really fully comprehend what's being asked from them, and then they start doing the examination, and then you're like, what are you doing? What are you doing? That is not what was asked. And the nice thing is, if you have a patient and a live person who is in front of you, and then they can speak to you, you are allowed that, please, like, one of the first things that you need to do when you, as a doctor, when you are building the report, you greet the patient. You can even ask my name. Unless the name is written there, you can address me by that name. Please get consent. Ask the patient, introduce yourself. Hello, Mr. So-and-so. My name is so-and-so. I'm a final year medical student, and I've been asked to examine you. Is it fine? You can even go, when I was doing the exams right now, some of the students really impressed me. They said, I've been asked to do a shoulder examination on you. It's going to entail me touching you, moving your lips, undressing. Are you comfortable with that? Can we proceed with? And then I said, yes, it's fine. You can do it. They've obtained the consent. They've gotten those marks. And, those things, you get your marks there, and then you go, and then you're like, cool, now let's get into the exam. You see, you've read the scenario, you've spoken to the patient, you've built a rapport with the patient. Another mistake that I've picked up quite often is that when there's a patient, remember, they might bring me as another doctor to be a model. When you see me, don't see me as another doctor that works with you in the firm that you've seen in the hospital. Take me as a lay person. When you take me as a lay person, it means you're not going to speak the medical jargon with me as a patient. You need to speak to me in simple English. During these previous exams that I was working on as a model, some students used to say to me, please do flexion and extension, do internal rotation, do external rotation. And I literally stood there and I was like, Doc, what do you want me to do? I don't understand. Because now you need to tell me, you can speak of flexion and extension, internal and external rotation with the examiner, but not with me as a patient. Because remember, you're speaking to a layman, and you need to speak English that I will understand. You can show me what you want me to do, and then I will do that. And then as we are doing all of that, you can tell the examiner that we are doing flexion and extension, and then there is full range of motion and all of those. So even with a specialist test, somebody said to me, I'm now going to ask the patient to do the empty can test. And I'm just sitting there like, what is that? Because I know you want me to do this, but as a layperson, I don't know what you want me to do. You must tell me, show me. You can say, Mr. So-and-so, please do this for me. And then you tell the examiner that what I'm asking the patient to do now, I'm doing the special examination, and I want them to do the empty can test. So you see, with that, you getting your marks there from the examiner, and then your layman, the patient, also knows what you're asking them to do. And most importantly, please have a structure. Have a structure, have an approach. Having a structure, having an approach means that you are thinking of things, they are coming out in a logical way. You are not just blurting out things as you move. Because even with the ortho exam, people will tell you, I'm going to do the look, what is it? It's, you look, you move, and then you touch. I'm not an ortho part. But basically, you inspect, and then you ask the patient to move, and then you'll do passive and active movement. One, you ask the patient to move their own lip. The second one, you ask, you are the one who's moving the patient's limbs, and then the other one, you would say, I'm going to do the special test to test for the different muscles. So you see, if you have a structure to say, I'm going to do this, then I will do this, then I'll do that. If like the examiner, as they are ticking on their tick sheet, then they can follow you, rather than somebody just saying this thing and then they're saying that, they're saying this and then they're saying that, and then you're like, what do you mean? They will ask you to do the cardiovascular system exam, and then you don't do your normal, I'm going to inspect, I'm going to palpate, I'm going to auscultate. You don't do it in order. Then you're also going to be confused, you're going to miss a lot of things. So it's very important to have a structure. Have a structure and stick to it. Your things must have logic. It must see that you are thinking about it. They are asking you, what are the different causes of infective endocarditis? And then you say, under CVS, this is it. And then under GIT, this could be the causes. And then you're like, under respiratory, this could be the causes. And then in that way, the examiner can see that, wow, actually the candidate is thinking of this. The candidate has structure, rather than just giving random answers that fall into different systems and then you don't have a structure. So having a structure works. It makes people sit up and take note of you, and that's all that we want. And also, with this, also very important, speak and do. Speak and do is very, very important. Don't just say, okay, right now I'm going to start moving the patient's limbs. I'm going to ask them to do 1, 2, 1, 2. No, let's go. Ask me, say, move your hand to do this. And then as I'm doing all of that, you are telling the examiner exactly that I am doing this. The reason why I'm doing this is this. And then as you are going, you are also reporting your findings. It's always important to report the positive findings and the negative findings that you find as you go. Then it shows that, okay, the candidate is fully aware, the candidate is awake, the candidate is, you see, there's logic to the things that they are doing. They're not just doing things because things need to be done. So also make conclusions to say, after I found 1, 2, 3, this is what I'm thinking of. Okay, I was thinking it could be this disease, but there are these negative findings that I thought that I wanted to find in the patient. However, I could not find them. So you see, you're making conclusions. You also, as you go, if you are making conclusions, you are mentioning positive and negative findings, even if you're going off, but it shows that the candidate is thinking. The examiner sometimes might bring you back to say, okay, don't you think it could be 1, 2, 3? Did you think about this? And then always take what they say and because sometimes they're guiding you to say okay, and then you think more of those things also, then you start looking out for those. So it's very, very important you mention important positive and important negative findings. And another important things, you please do not lie. I found that sometimes the candidates lie in the OSCEs. I know you don't mean to lie, you just sometimes you want the signs to be there, and then you start lying because you're expecting this sign, you don't find it, but you're saying there is that sign. Please don't lie, because examiners, they do also examine the candidate, no, not the candidates, the models before. So they will pick up the signs, they know which signs they want you to pick up. So don't lie, because sometimes you might lie and you find a professor that is really, really ready just to fail you because you've really just been ticking them off, and then this is the final straw, and they just go with your lie, and you're going to keep on digging and digging this big hole for yourself, and we do not want that. So it's very important not to lie. Also, with that, I wrote another important point here that I said, please know when to stop talking. I know I've been talking throughout this video, but at the end of this, I'm going to end the vlog, which means I would have known when to stop talking. You need to know when to stop talking, because often you'd find that a candidate would be so brilliant in that particular station that they managed to finish the station within half the period of time. They've already covered everything, but now because there's this time that's still remaining, the person just wants to continue talking and talking. Now you're talking lies, now you're talking rubbish, now you're making up things. So you need to know when to stop talking. Sometimes you're not really prepared for that particular station and you don't really have much to say. Silence is key. Silence is golden. It's very important to know when to stop talking. Do not talk continuously. And after a bad station, please, especially if it's multiple stations, one station after another, after a bad station, you need to forgive yourself right there and there. Do not carry a bad station to the next station. You just have to, you need to be on autopilot when you do OSCEs. One station to the next, because sometimes we have 15 stations, one after the other. You cannot be beating yourself up because of station 2 when you have 13 more stations to go through. So you get through a bad station, you please, by all means, during that station you can be sad, you can be everything. You move to the next station, you just have to leave that station there, because at the end of the day they're going to take an average of your stations and then you will still pass. But if you're going to take that bad station to all the other stations and ruin your entire OSCE experience, you're going to fail. You'll have to repeat. So if you have one bad station, don't beat yourself up, forgive yourself right there and then you can beat yourself up after the OSCEs. Remember that half the time you think you're doing horrible, sometimes your examiner will be like, probably just the nerves. Maybe you found a very nice professor that will still give you 50%, and when you are beating yourself up when you could have literally just passed the other stations quite well. So it's very, very important not to beat yourself up because of a bad station. You just move on, you carry yourself, and then you hold your head high and just go. And very, very importantly, I said you must have fun. You must have fun when you are doing your OSCEs. Remember that we are all rooting for you, your family is rooting for you, and we are all just waiting to cheer for you. And I know sometimes as us, the models, it can be awkward. You know, when a candidate is really, really having a horrible station, it's not nice. It's not nice for us as the model. I think it's also not nice for the examiners because they also beat themselves up and they feel like we are not teaching the students. But have fun. Have fun in your OSCEs. Always practice with your friends. You cannot go to an OSCE without practicing with other people. examine patients, remember medicine is learned at the bedside. It's not learned at the textbook. The patients will have all the diseases, they will have all the answers. Our patients, our textbooks. So always examine the patients, start preparing early and you'll be fine. We'll be out here rooting for you and we're hoping that you guys are going to have the best OSCEs. And that is for this video. If you did enjoy it, please give it a major thumbs up. And don't forget to comment, don't forget to share, and do not forget to subscribe so that we can share this content with other people. If you did enjoy this video, I will see you again on the next one. For me, but you can call me the Med Guy too. Please call me the Med Guy too. I'll see you guys in the next video. Bye.